Hi, I'm Katerina,
I'm Hannah.
and we did our home health project on Mr. Calderon, who lives in Peachtree City, Georgia, with his wife in a 2-bedroom apartment.
We did a safety check of his home, and we found that there were many shag rugs around the house, and the patient stated that he gets cold very easily, so he wears slippers. He also uses a walker, so we told him that this could be potential fall hazard for him to walk around with rugs in the way while he's using his walker. So we suggested that he remove the rugs for safety.
In relation to our patient's medications, we provided him with a medication chart that listed all of his medications. We taught him the teach back method, which taught him taught every medication, made sure he taught us back to us. Some of his medications were Coreg and Avapro for lowering his blood pressure, and then Lipitor for lowering his cholesterol. With each one, we made sure to go with which the route, how much the dosage was, and to make sure that he knew what he was taking each medication for.
To manage his health condition, our client visits his healthcare provider once a month or more if he's feeling sick. He monitors his blood pressure while he's at home and keeps a log of it that he can take with him when he visits his healthcare provider to see if his medication is working. He has slightly altered his diet to include less sodium and has eliminated foods that can irritate his IBS, such as dairy products and spicy food. He cannot walk far distances, but he tries to get in a daily amount of exercise by walking around his apartment with his walker, or even doing range of motion exercises while he's sitting in bed or in a chair. He takes naps often to kind of re-energize his body and promote relaxation.
Our patient has many community resources. His primary health care provider is only an 8-minute drive, and his hospital is about a 16-minute drive from his house, which is pretty reasonable and easy to get to if he ever has an emergency. He has many resources with his local church. They have many memberships for elderly where they can come gather just to hang out, or if they want to get together and talk about their illnesses. And they also provide many cares for blood pressure checks, cholesterol checks, anything that they possibly could need within a reach of their church, which is right down the street. Both of the patient's daughters live within 30 minutes, so if they ever need help, they're within phone call away.
At home, the patient has many resources to help him manage his condition, such as a electronic blood pressure cuff, which, like I stated earlier, he logs his blood pressures to take them with him to his physician visits. The patient does not have a home health cholesterol testing kit, which we stated would be helpful to him to monitor his cholesterol.
Our patient lives with his wife and is not a caregiver to anyone else. His wife is the caregiver for him, who helps out a lot with everything within preparing meals, getting his medications on time, taking him to doctor visits. The only thing he doesn't help him with is doing breakfast, because he does like to be self-sufficient with that. She also cleans around the house as much as possible, but they also have a cleaning lady who comes and deep cleans the entire house to make sure everything is clean and good with allergies and no dust and dirt for them. He's very trustworthy with this cleaning lady, so occasionally he'll stay with her and let his wife go and do groceries and get all the food that's needed and any errands that need to be done, so he has someone watching over him at all times.
We educated the patient on what exactly high blood pressure is and gave him a chart to show him how to naturally lower his high blood pressure, and that chart is provided in our
Appendix
A.
With talking to our patient about medication and safety issues around the house, we believe that we educated our patient very well on his chronic conditions and anything that could help possibly. So thank you for listening.
Thanks.
Bye.
Bye.